So, welcome to today's podcast, Empowering Communities, the podcast where we explore the vital roles of community health workers and the impact we are making in communities, right? I am one of your hosts, Shantony, and today we will delve into the world of community health workers, what they do, the impact they have, and why they are essential in our healthcare and communities. Patrice?
Hi, yes, everyone. My name is Patrice Shelton, and I am a certified community health worker.
Stephanie?
Hi, I'm Stephanie Carrington. I'm also a certified community health worker senior, and I'm also the board president for the Virginia Community Health Workers Association.
Awesome. So let us get started with this conversation. This is amazing.
Right.
Best friends for quite some time.
Yes, years.
And now we are. We are here.
Mm-hmm.
Inspiring and thrilled. I'm thrilled.
I am too.
Thank you
Excited,
for
yes.
giving me this honor. So let's start by telling people how to understand the community health workers, right? And who are they? How often they serve communities? Do they do it every other day? We've been talking about this.
Yeah, right. We wish. We wish.
And why they are trusted members of community.
Right, definitely. So community work is every day. We wish it was every other day,
Right.
or once a month, or once a quarter.
Yeah.
But it's every day, all day. And we can use examples. I'm just getting here from serving the community, from doing Feed More.
Wow.
And that was a program that's 11 to 12 is when I serve, and now we're at about 6 o'clock.
Yeah.
And just finishing with the community. So we definitely are not a every other day or a time frame on community health work. We are there when the community needs us. And so we definitely want to make sure that, you understand that a community health worker is not a 9-to-5 person.
Mm-hmm.
Our clients, our communities, they look for us for trust. They look for us for facts, and they look for us to care and listen. It's not always about going in when you have an issue and wanting someone to tell you how to fix it. Sometimes they just want to, unload. And sometimes, that helps a lot versus handing them something or telling them something or saying, don't do this or do that. Just sit and listen. And so CHWs have such a rounded, position. And one of my things that I say all the time, and you all know, is, you can't be trained to be a CHW. You're born.
Say it again for the people in the back.
Yes,
Right.
You are born that, and as especially if you're that person in the family that is always helping someone or always making sure that someone knows where to go for something, you're already being a CHW. Only thing that we can be trained on is how to really look for resources.
Right.
How to engage and things like that. But the passion of a CHW is what you're born as, and so. It's not, like a doctor, you can be trained how to cut open someone. You can be trained how to diagnose someone. But a CHW, that is a given thing that you're born with. And so it's very rare. And so, as we go through, the three of us with a lot of our partners and a lot of our other organizations go through of trying to make sure that it is a workforce, it's really hard to put a CHW's position on paper because it's not typical. And there's so many obstacles to have it being recognized that it's hard, really, really hard to get established or making it known across, the nation of what a CHW does, because it's just not put it black and white on a piece of paper. It changes daily, hourly of what a CHW is going to do. So
Priorities are different, right?
They are. What is the CHW in my world? I think Patrice summed it up nicely. But to add to that, CHWs are a part of the community. They are the community. They're the trusted member of the community that everyone wants to go to, that everyone listens to their voice, that they make sure that other voices are heard. Community health workers are the trusted member of your community or your organization that's a part of your community, that understands your community, that is firsthand affected by the community. And they serve as a bridge for to reach the resources that you may not have, or with healthcare providers, they would serve as that bridge to connect you to them, to services you may need. As Patrice said, there is no time, to answer your question, like a daily thing, or do they work 9 to 5? They listen to Patrice. Oh, they might work evenings. No, they work whenever the community needs. Each community is different, and they understand their community. Their community understands them and trusts them, and are them. So they're the community. I would like to say we're the best part of the community. No, just kidding. But we're the part of the community that makes our community make sure that our community is heard, make sure our community is seen, and make sure that our community is cared for.
And respected.
Respected and not forgotten, no matter what community that is. So communities come in all different forms and shapes, and community health workers just make sure that our little piece of the puzzle is seen, heard, and fits in and gets what it needs to stick.
Yeah.
Along with culture.
Along with culture. Yep. I agree.
In that respect, it's important. Because culture is not just necessarily a language.
Right.
It's the understanding that the group of people have and value, right?
Yeah.
And so thinking about that, right, and going into what exactly people know about community health workers, can you tell me any crazy story you've heard about what community health workers are or anything that you kind of sort of had to counter, you had to talk against and clarify? Because it's happening so often. And it's so important to delineate, to clarify those situations, because it could be misinterpreted or it could be taken into a context that it's not supposed to be. Thinking about medicalization of community health workers and how does that impact, right? Steph, you want to start?
Oh, I'll start, sure. So I'll use a story. This kind of bothered me. We were in a meeting and we were talking about how Medicaid is about to require hospitals to do social determinants of health screenings. Great, right? And so a physician who was in the meeting made the comment that, well, while they're there, they can just take blood pressures, because that's usually what we do with them. Just to take blood pressures along with asking the questions. So not understanding that community health workers are not just your people who will do the nitty-gritty that you don't want done, and understanding that they are a vital part of the team. Not that, they're just a community health worker. They're a vital part of the team. They're a strong part of the team. They're a strong part of the team. They are part of it. So it's like if you have I like the analogy that I got from you. If you have a shirt in the factory, if you're only making the front part of the shirt and not the sleeves, what good is the shirt? And so just knowing that they are a part of the team, that they are important. They're not just an outreach worker. They are not someone we cannot diagnose.
We don't want to go into that anyway.
We don't want to go into that. That is not our field of expertise.
Absolutely.
And also, I made an analogy earlier that I'll use now. Community health workers are misunderstood a lot, and it's the trust that's the biggest, most important part. If you have a professor, I'll use the same thing. You have a professor that you see 2 hours a day, 5 days a week. And let's say you're dating and you have a partner, a boyfriend, girlfriend, whomever, that you see 2 hours a day, 5 days a week. You see both of them the same amount of time, but who knows you best?
I think the boyfriend will know me best. Would you?
The boyfriend would know you best.
I don't know.
Really?
But your professor, would you tell your professor deep secrets
that you would
tell or your boyfriend?
It would depend on the professor. Because, some of our teachers and professors and educators have that CHW background. So they're more caring. They're more listening. They're not going to just teach and not, they know that part of their job to get you to learn is to engage. And so some of that pieces is, and you know, in a relationship, you sometimes, you know, you share certain things, but sometimes you don't want them to carry your burden. So you might feel more put it to that professor to carry some of your burdens because you don't want to stress out your partner. So it just looks at it differently, but it has to be the right professor. It has to be one that is going to be caring. So if it's just one that's going to just come in, teach, give me my lesson and go, now they don't know me.
I was speaking of a professor. I was speaking of this analogy as the depth that they'll know you.
Okay.
And I'm speaking of this as the depth that they'll know you. If I'm here to teach, I'm here to teach. I am a caring teacher. You know, I care, but my job is to make sure that you learn X, Y, Z. The same thing to me. And I love nurses. I love doctors. Don't want you to think that that's what I'm speaking against. But if a doctor or a nurse has about 20 minutes and my job is to teach you how to use this insulin. I'm going to get there. I'm going to make sure that you understand how to use the insulin.
The basics.
But as a community health worker, I'm going to make sure you understand why you're using this. I'm going to make sure you're able to get this. I'm going to make sure you have everything else you need to use this. I'm going to make sure your lights are cut on so that you can
maintain your insulin.
It doesn't go bad at the temperature. And not that a nurse isn't doing her job. Not that a nurse's job is not just as important to do what she do, to do the measurements, to tell you what to take and how to take it. But the community health worker is just going to get a little deeper. I'm going to know as a community health worker, hey, you know, as a nurse, all I can do as a nurse, not all, but what I do as a nurse is I say, hey, I gave you this medication. Are you following protocol? Yes, I'm taking my insulin. But as a community health worker, I'm going to be like, she's taking her insulin, but she's taking I see her every day eating buckets of sugar, or she's taking her insulin, but I'm noticing certain things. She's taking her insulin, but she hasn't been to pick it up. And
you're reading
the body gesture and the comfortability, right?
Right.
I can identify with certain things that this client is demonstrating behaviors, right?
Right.
Then I can say, and ask questions.
Right.
Like, oh, I noticed that you are losing some weight. What you doing, girl?
Right. Right. And then they can tell you, eating right, taking my medicine, exercising.
Or if I'm not doing that, I was like, no, I'm not doing that. Right? Stress. Right? And things that will be in depth. We were talking just earlier about certain things that sometimes is perceived as behavioral changes, but are not seen as stressors, right?
Right.
So if I start drinking, right, I may lose some weight because I'm just drinking. Then somebody else who is not a trusted individual will be like, oh, what you doing? Oh,
you're just drunk.
Right. You smell funny. Right? Judging me.
Yeah.
Community health workers don't judge.
Yeah, we don't judge.
We understand.
Yeah. And we've been through it.
Right.
Either ourselves, our family members. And so, you know, we have that compassion to understand that you had a child's trip come up and you don't have the money to get your medicine because you wanted, you know, as parents, we always going to make sure we're doing for the kids before ourselves. And so, you know, we're not going to get our medicine. We're going to make sure that our child goes on that trip so that they can have fun and, you know, enjoy childhood. And so, and we can understand that. But someone that hasn't been through it and always has everything that they need, they don't understand how you have to juggle those things. And so then when you come to them and you're asking them for those things and they're looking at you like, you don't know? Well, why would you pay for the trip when you know you need your medicine, you know, or why you couldn't do both, you know, and not understanding that their budget is a lot tighter
or priorities
than what your budget.
My priorities are not your priorities.
Yeah.
Right.
Yeah. And growing up, you know, even in different households, you know, we can live in the same community, but our upbringings might be different. And so, you know, to have a CHW, we can adapt because we've been there. We've had those struggles, and so much of that lifestyle that we've come up in have created us to be able to be a CHW. Like I said, you born one. So, you don't get trained that stuff. And so you know how to sit and listen. You don't need someone to teach you how to listen, because you're going to listen to how you want someone to listen to you. You're going to treat them how you want to be treated. You're going to go and ask them. You're not going to tell them, because you wouldn't want nobody to come and say, and I know I'm a plus size woman, and I have arthritis and different things, but every time that my doctor came at me and was like, well, everything is your issues is because you're overweight, or you're over obese, obese. And that did not make me want to change, my lifestyle or anything to lose weight. But when I came to realize that I have lymphedema, and the only way that, and then I'm stuck in the bed, and now I have a different outcome of I have my other CHWs pouring into me and educating me on, because they know similarities of lymphedema. Then I was like, okay, so now I'm going through the processes, and whoop, whoop, as of now, of 92 pounds down.
All right.
That's right.
And mind you, my weight was never my issue. Like I love my plus size. I love being full size. But of course, me being able to be mobile was more important than
your why.
The vein.
Your why.
Your why.
Yeah.
And that's where you were.
And that's what happens. And so, we as CHWs, we recognize those things, and we know how to step in. Just like I said, my coworkers, they knew how to support me and step in and give me that encouragement and that information, and share with me of, different protocols and things of routes and journeys that they've taken to lose weight and get healthier. And now, I can celebrate that from what a CHW, even though me being a CHW, but I benefit from having a CHW. Yeah. And that is what's so great about all the different organizations that we have that are CHW led, is because we have that in the forefront of how we can help to promote and how we can uplift and how we can make sure that they are okay. Because, just even like if it's a doctor, how many doctors someone else is checking up on and saying, how are you okay? How can can we help you? And so to have CHWs that are doing that now, and thanks to Shantini, such a great lead of, as she sees something, trying to find how to knock down that wall or that barrier. It's so great to have another CHW just to check on us and say, hey, I know it's been a busy week. Did you take your medicine? It's been a busy week. Did you do your exercise? All those things. And so I think, and then even if it comes down to needing some of those social deterrents, maybe needing your rent, looking for resources around rent or utility bills or, childcare. It is so easy for us to do for our clients, because that's what a CHW, we're always giving, we're always, doing that. But it's really hard for us to step back and really take care of ourselves. Yeah. And knowing that we preach that to our clients all day, every day. You got to take care of yourself first. You're not going to be there for your kids or your parents or your siblings, or if you don't take care of yourself. But CHWs, we're the worst when it comes to listening to our own selves, knowing that we're crazy about that. But it works. And people doesn't realize that the CHWs, that's a community within itself. Yeah. Because of the fact that, it's so much trust, because CHW, we gonna give it to you like it is. Right. We not gonna
sugarcoat, do anything of that.
No, we're gonna give it to you factual.
And the one good thing about CHWs, well, one of the good things about CHWs is we're able to give it to you factual, because you trust me,
and we have that relationship. Right?
Yeah. We already have it.
Like, girl, you're tripping.
Yeah.
And then that accountability, right?
Right.
Because we have that relationship going on. Yeah. People is like, oh, I have the CHW thought, thinking from a client perspective. I hear your voice. I hear Shantini speaking to me right now, and I'm not nowhere around, right?
Yep.
So we all need a CHW in our lives.
Yes.
And Stephanie brought us back to the essence of a community health worker. So there are roles that are so wide and broad. And so we know that in thinking about the core competencies, thinking about the national C3 consensus, where it mentions the skills, things that they must have that are unique to. We know that we need to be in certain perspectives, health educators.
Right. Yeah, definitely.
What else? We can be definitely the outreach piece, because if not, how people will know
and help them
that
enroll.
Exactly. The advocacy, extreme, superb importance.
Right.
And then support, social support, right?
Yeah.
But something that we have been doing more of is data collection.
Exactly. That's very important, especially right now with so much expansion and stuff going on. Well, all this hard work that CHWs have done and been doing over the years, documentation is very important, because
And I'm the worst.
it's very important. So we've been recognized by universities are making studies and researches and just having things
Being published.
written, being published, and having things written so that we can tell our support, our legislators, they want to know what is this? What do CHWs do? Show me what they do. And so we can tell the stories all day long, but when we have data to back that up, we're awesome. That's how we empower our communities. To bring the money, to bring the needed resources that are there.
Right.
It's CHWs, like I said, our voices are very important, but we need data to help this. And
so there are many cases in which data is being used, right, to support and evidence the impactful work. But what happens after? After we've seen that people come and gather the information, they say, yes, we found out this, and then they leave.
Well, that's why we advocate. I'm going to use it.
I was going to say.
It's a big thing in my community. I hate it that when people get information, because I want my community to be a part. A lot of times it's very hard for all of us, even as women. We're women. We're nurturers by nature. Sorry, guys. But we're nurturers by nature. And so I like, oh my gosh, Anthony needs this. Let me give it to her. No. As a part of community, we know what our community knows what it needs. Ask my community what it needs. You might think I need a coat, and I'm like, no, I'm not gold. I don't need a coat. I need a fan.
Never.
I need a fan.
Yeah, don't pimp my community. That's my slogan.
So
don't
help
pimp.
the community. When you get the information, give it back to them. You'll be surprised if you go around and say, hey, most of the people, I did a survey, a lot of people in your community have high blood pressure. You know what my community did with that information at one time? They started this program called The Biggest Loser in Creighton, and we started an exercise program, and whoever lost the most weight in a certain amount of time got some money. You remember that? And it was awesome. It was an awesome program that was started by the community. So the community knows what it needs. It knows it probably has an answer to how to solve the problem.
Right.
If they had someone to listen to them.
There you go.
Yeah.
That's so important, Patrice, because it tends to be the voices, the outside voices that come and direct how things should be instituted.
Right.
But that's where you speak about the advocacy.
Advocate.
But also finding the solutions from within, which creates empowerment.
Right, definitely.
And so what has been your experience with that, if you...
Okay. So definitely. When I first started this work, because as I tell my stories all the time, that I'm not a people person. I don't like to be around people. How are you a CHW?
We love you.
I know, right? but I love to see people at their best. And if I have a resource that I can help someone to be at their best, so that makes me feel good. And so what I learned was when I very first started this work, because I come from retail, and so 12 years ago, started doing community work, and the community that I was, working in, I was living in at that time. I wasn't even working. I was living there, and then I started volunteering with the organization. And the kids wanted to play sports, but they wanted to play sports under their own community's title. They did not want to play under another community's title. And so what I I did, since they brought, that's what they wanted to do, we created their own community teams and actually end up being the largest teams in the leagues, and had all age groups. And so instead of going out and trying to find the high school, jock that the graduated football quarterback and all that to coach, I went out and got the parents or the uncles and the cousins of the community members or ones that was in the community that have lived, that they could better reach out to these young kids and they could be able to turn them around so that they don't go down the same road that they had went down.
Right.
And so it never was about them winning. It was all about getting their attention. So then we got their attention, then we could have the parents' attention, and then, building that respect and all that, and trust and all those things, and, bringing the kids in, and I sign them up, and I'm telling them, once you sign this paper, I'm going to treat them like they're mine, I'm going to discipline them like they're mine, and I'm going to love on them like they're mine. Right. And so, and that's how, it started, and, building those things. And now to this day, like 12 years later, these kids that were 6 and 7 coming to me are now coming in and working for us. Awesome. We have, at some of our, centers and stuff. And so through, and being a CHW, and so, those are the things, but it was from asking what the community wanted and needed, and what and I know I went all around the barn to get to it, but definitely that they wanted to be in a sports team of their name, and so let's make it happen. And so we sent out to partners and different ones that I had built relationships with when I first started doing the work, and we had people to sponsor the kids, because it was when we first started, we wasn't with the rec league, so we was with what they call the travel and the AAUs and all that. And so it was like $300 and $400 per child. Now, mind you, I'm talking about public housing children. The mothers, they're not having money to feed their children, buy extra clothes for school, let alone now let's talk about a shoulder pad and some cleats and some pants. And so it was great with partnering up with the organization, the other organizations, and we call them our dream team. So whatever the community dream that they wanted, our dream team, which was our upper class and middle class partners, they would help us make it happen. But it wasn't that they came in and said, well, you need to do this and you need to do that. It was the community. They were, saying what they want to do and what they were dreaming of, and how, and then they had the resources and the assets to make it happen. And that was a great partnership. And to this day, and they still come back and visit the community. Like I said, we're going on 12 years. Wow. And, and they still know them and stuff. And so, and that's relationships that would not have been created if it wasn't for a CHW. Right. But only that CHW of that trust and the relationship of being with the community, being able to bring them, like you said earlier about the bridging, not only bridging between the client and the doctor, or the client and, nurse, but also building bridges between the income and class levels and things like that. And, and making sure that people can understand, everyone, because, when you're dealing with low income clients, the first thing someone wants to say is lazy or uneducated, or not realizing that they were where you were a year ago, but circumstances happened and that put them as a low income. And so being able to not only have that, that partnership build and turn into a friendship, but also having it be an educational session for, for middle class and upper class to be able to understand, the situations of why someone's in those things. So great combination, but all again goes back to because of a CHW was in that place and at that time, and being able to do that connection.
Absolutely. Identifying the needs, empowering and creating agency for the community, and self-determination, because they were the ones who directed the pathway, and creating, building capacity, from within,
and recognizing,
because we have strengths, assets.
Exactly.
Because we definitely, especially the three of us, we're always trying to find, someone that is, already doing in the community, and then to, introduce them into the CHW work. I use a prime example, as I said earlier, about, the organization that we was just doing in the community. I am the lead director, whatever that title is, but I also have stepped back, because I've been doing it since 2011, but I step back and bring a community member in. And so as questions come up that a manager or some should answer, I have that community member do it and say, so giving her that ownership, her community,
right.
You go to her. Now I have to teach her how to say no. Because then when she needs to say no, she's go ask Patrice.
But that's good. That's a good game plan.
I know, right? So then, I'm the no person. So, but then I send them back to her so she can get comfortable in being able to say, no when she needs it, and understanding how to adjust for the circumstances, but also having ownership in her community. Because as we give so many of our folks that ownership and that say and that word in their community, how much better their community can be, because they know what they need. They know what they want to see. As we talk about deterrence of health, thinking about safety, they know how they feel safe. They know what needs to be done for them to feel safe.
Right. And I love it. But that you said that about community health workers helping, empowering others to become community health workers. Because the one thing about community health workers, the one thing about our job is our job gives and it continues. It's continuous. Because if you're a part of your community and you teach, we're like not giving them fish, we're teaching them to fish. That's community health work. And so as we teach them to fish, they can feed themselves and then teach others to do the same thing. So we're the gift that keeps on giving.
A domino effect.
Definitely a domino effect.
Big
Definitely.
One.
And we try to work ourselves out of a job.
Definitely.
Not really.
We just move out the way.
Yes, that's exactly, which is part of the mentorship, right?
Right.
Because we go to that tier in which we have the experience. We know what it is to be in the field. And now we have grown to the point in which we want to give back.
Right.
And so important in that is in also sowing seeds in the future. So this is our time has flown, girls.
I know.
It's like almost to the hour. But the last question I would love to hear your insight is about the future, right? So how do you see the role of community health workers evolving in the next few years? And what would you tell the new or the incoming CHWs?
So I would say definitely I can see as every private practice, insurance agencies, not just medical insurance, but even vehicle. I can see all different types of organizations having a CHW, because some people will go into a business that they have to go into because it's a necessity. But they won't be able to focus on it because they have something else in their back of their mind that they need to deal with. And so having a CHW at that site would be able to reach them. And so, I definitely would hope that we could get a CHW at all businesses just to have, because someone could come in with mental health issues and, that clerk would not recognize that. But if they had a CHW there, they could recognize that. So I definitely want to see them to have that. And also to what I would tell the new CHWs is definitely set boundaries so that you would not burn out, because we lose so much of our good support when we don't set boundaries. And I know I made the comment a little earlier that I'm the no person, and that's my boundary, because and it's also my push to my clients, because if I say no and you okay with that one no, then you really didn't want it. But if I say no and you come back, well, Miss Patrice, I can do this, because they can add into it because I'm not an enabler. And so I want to see you put into your growth as well as you want me to put into it, but I'm not going to do it more for you than what you are. I'm not gonna, I need you to engage, and I need you to have some skin in the game too. And so definitely those would be my two things, is definitely seeing a CHW in, different fields, not just the medical field, but then different organizations and businesses. And then also for them, to the new ones, to make sure they set boundaries so that they don't get burnt out.
So I see the future of CHWs. I see our workforce growing. I see our workforce not only growing, but being recognized. So there's so many CHWs who do this, who volunteer based, who do this. A lot of times when we've been teaching a class of community health workers and a light bulb kicks, like, I've been doing this, like, I don't do this all the time. I was a navigator, but I was doing this, or I was the front desk operator, but I lived in the community and I would bring people with me, to the doctor. I would navigate people through these Medicaid system. And Miss Stephanie, I've been trying to explain to people how Medicaid and Medicare is different. So they've been doing the work, and it's like a light bulb click. I do this. And so just the recognition of our job I feel like that'll be the future of community health work immediately, like being more recognized and understanding why we're important. Not just you can help people fill out a Medicaid form, or you can just help people but you're a part of the community, you're trusted. And so I think our trust in being a part of the community will help us be more recognizable.
Yeah, right.
And my little piece of knowledge or encouragement for future CHWs would be for them to advocate for their community. Make sure you speak up. Your voice is important. Don't let anyone tell you that it's not, no matter what community you're from. If you're volunteering, if you are working, if you're underpaid, if you're overpaid, just making sure that voices from everywhere are heard. And so that would be my bit of advice. Continue to do what you do. Make sure you keep the bridge going. And I think we're going to be recognized all over.
Amen. So for me, it would be, I like money, so I want community health workers to be reimbursed and to find sustainable funding for
$60.
Exactly.
Like the $60 an hour.
South Dakota, that's $60. But for community health workers to be recognized monetary, so that they will be able to support themselves and support their communities, right? Because we pay for doctors, right? You want to see a good doctor. I want to see the best doctor, right? And they have their own pricing, right? You want the best, you got to pay for the best.
Right.
So why not use that same principle in community health workers? The advice I would give to community health workers who are entering the field is that always work to expand yourself. So learn, find your specialty area, and educate yourself as much as you can and get exposed to. And always be that light that shades light to others, because it's so important. So learn, and keep on learning.
Yeah.
And so just to close, I want you to get involved, do a call of action. If you found this discussion very enlightening, that you start delving a little bit deeper in learning more about community health workers, right? And the role and the impactful role that they have in communities across your community, across the state, and across the world, because they are everywhere. And so visit our website, access resources on various sources. Come to the Virginia Community Health Workers Association.
Yay.
Follow us on social media and comment. Bring out what you like the most about this episode. We'll have some more, right?
Real soon.
Real soon. Okay, so we're going to have a surprise visit of guests, or who? What?
Let's keep a surprise.
I like it that way.
Surprise. Well, thank you, ladies, for being here today. It's been amazing experience.
Yes, as always. The trio.
And Merry Christmas to you all.
Yes.
Feliz Navidad.